Right, shall we start? And then if a few people join along the way, they probably won't have missed very much, and I can always recap on things as well. So I just wanted to thank you all again for joining the second session in the Cancer Care Review training for healthcare professionals. We have actually started recording already, just so that you know that. My name is Katie Massey. I'm a GP working in Buckinghamshire, and I'm also the Macmillan GP for Bucks as well. Have the next slide, please, Anna. Thank you. So just so that it's to do with bandwidth, so if you can mute yourself, which I think you all are as well, and usually we turn cameras off, but there's not too many of us, so I think the bandwidth should be okay. If you've got any questions, please just pop your hand up. I'm more than happy to answer them as we go along, or if you feel better putting them in the chat box, that's absolutely fine as well. Next slide, please, Anna. So this is just a bit of a recap over what we've covered and also what we're going to cover, just so that you know. We did actually switch session 1 and session 2 around. So this session is about the cancer landscape and an introduction to cancer care reviews. And last week, Annie from BHT, the cancer care consultant nurse, did a bit of an introduction as to what cancer is and the common cancer treatments and how to talk to patients with cancer. Session 3 is motivational discussions with patients with examples as well. And I think that's applicable to all kind of long-term conditions and all those kind of tricky conversations that you might have with patients about weight and smoking and things like that. So hopefully that should be very useful. And then the last session is about cancer care reviews in practice. So a more practical kind of look at them, how to fill them in, and some case studies as well. So just to look at what we're going to be covering today, we're going to look at the cancer landscape and how cancer incidence is changing, and the cancer story generally is adapting as we go through the years. Then we're going to look at the National Cancer Survivorship Initiative and what that encompasses, primarily the recovery package, which leads really nicely on to cancer care reviews, and to go into a bit of depth about the explanation behind these, some of the research that stem from doing cancer care reviews and the templates themselves and how to fill them in. Next slide, please. So why are we doing this? Why have we set up training for healthcare professionals in doing cancer care reviews? So it's acknowledged that practice nurses and other members of the GP team already form such a hugely pivotal role in the management of patients' long-term conditions. And cancer is now seen as one of these long-term conditions, as patients often require more ongoing support. They are surviving for longer, they're having consequences of their cancer that they're having to live with. And really, as a practice nurse, you're really well placed to deal with these patients and to see these patients on a practical basis. So the aim of these series of webinars, which are jointly run by Macmillan and the CCG, is to provide education and training for all healthcare professionals, which hopefully will help to make you feel more confident in undertaking a holistic cancer care review in general practice. So looking at the cancer kind of consequences, where does cancer sit at the moment? So the 10-year survival for cancer is now 50%, which is amazing. People are surviving for longer, and that's down to a multitude of reasons, really. But we've got much better diagnostics, so cancers are getting picked up at a much earlier stage. And the screening programs are doing what they were set up to do. They're detecting cancer before it's spread and at a very early part in their cancer journey. And we've got much better treatments, so patients are not only getting diagnosed earlier, the treatments that they've got access to are hugely improved as well. So currently in the UK, the number of people living with cancer stands at around 3 million, but we know that by 2030 that's set to increase to at least 4 million. And that poses a huge demand on the NHS in general, because there's patients that have survived their cancer or are living with cancer, and there's lots of recovery challenges for those individuals. And if you just break it down in kind of the physical consequences of even being diagnosed with cancer, so that patient may have been led to go to the GP because of some physical symptoms, and then they've undergone treatment, which often has a physical consequence or toll on them as well. So we're dealing with the physical aspect of the cancer diagnosis. And then the psychological strain that may have had on that individual. People cope very differently with it, but it's widely recognised that going into the future, people do have psychological concerns that we have to address. And then the social side of things, which is often missed, really. So we know that people who are diagnosed with cancer are more likely to lose their job. If they lose their job, they find it more difficult to get into employment. So really, the whole biopsychosocial side of patient care needs to be carefully looked at for people going through cancer. Next slide, please. So this really just illustrates how cancer is changing and where the majority of patients with cancer are sitting at the moment. So the number of older people living with cancer currently is around 2 million. And actually, the most common range for people to be diagnosed with cancer is in the age group 65 to 79 years of age. I should say that older people are classified as anyone above 65. People over 75 are the only group in which death rates from cancer have actually increased from the 1970s. But that's probably due to a multitude of reasons. Probably at age 75, they have other comorbidities which potentially impact on the treatment that they may be able to have. But almost a third of cancers in the over 70s are only diagnosed when a patient is admitted to hospital as an emergency. And that's something we're trying to avoid. We're trying to aim to diagnose as many cancers as we can out of accident and emergency, because there's a really good tally that if you're diagnosed as in routine or a 2-week wait clinic, your prognosis is much better. And cancer is really just becoming a chronic disease, which has got to be managed alongside other comorbidities, as often this age range does have. Next slide, please, Samna. Thank you. So this slide just looks at how the total prevalence is changing, and it breaks it down quite nicely into those patients going through diagnosis and treatment, rehabilitation, and then all the other stages. And it shows how that's going to change over the next 20 years. And it's important to note that at every stage in the cancer pathway, the numbers of people surviving in each phase varies quite differently between the cancer types. And this is just a rough estimation of what's going to be happening. We know that this growth is partly due to more people being diagnosed each year and actually also increased survival. So you can see that actually the end of life care, the orange box right on the end, doesn't change that much, and you would expect it to if the more cancers were being diagnosed. But I think this just represents how much better treatments are getting and also how much earlier we're hoping to diagnose cancer. The current time-limited prevalence rate suggests that long-term survival will continue to increase at a higher rate, meaning the number of people living with cancer for more than 5 and 10 years after diagnosis will see a much bigger increase. Next slide, please. Sorry, this slide is really busy, but I just thought it was really useful because it looks at the 5-year survival rates for adults aged 15 to 99 years in England in the 27 most commonly diagnosed cancers. And it looks at their 5-year survival rate. And you can see that the lowest 5-year survival estimates are for mesothelioma, pancreatic cancer, and brain cancer. So these are all three are the ones that are typically diagnosed at a later stage. And the highest 5-year survival estimates are seen with patients with testicular cancer, melanoma of the skin, and prostate cancer. And the treatments with these have really jumped forwards in recent years. And not only are they often a visual thing or something that you feel that is wrong, so it kind of ties in that these patients are surviving longer. Next slide, please, Hannah. Thank you. So we talked about staging in Annie's presentation, and this just gives an illustration of how the proportion of cancers diagnosed at an early stage has changed over time. And it looks at, I don't know whether you remember, but when Annie talked about stages, kind of stage 1 and stage 2 is when the cancer is within the same place. Any stage above that means that the cancer is spreading to other places in the body. When you can look at this graph, it looks like there's a huge dip around March 2020 to around July 2020 in all different stages of cancer being diagnosed. Has anyone got any thoughts as to kind of what happened around that time period and it meant that less cancers were being diagnosed? just pop it in the chat box. If anyone's got any ideas what happened March 2020 last year. Exactly, yeah, COVID. So that, and actually seeing it like this in kind of a graphical form, it's quite shocking how much the cancer diagnosis has dropped. Next slide, please, Amna. So looking at the stats for this kind of period, in 2018 and 19, the number of the 8 common cancers diagnosed at each stage remained roughly constant, with about 44% of cancers diagnosed at stage 1 or 2. So we're getting towards kind of half of cancers being diagnosed early. And between March and May, like you said, the total numbers of cancers dropped significantly by 47%. So that's a huge drop. We've said, obviously, someone said that obviously COVID is due to that. Is there any reasons why you think that people might have been less inclined to come to their GP, or less cancers are diagnosed over that kind of period, or any other reasons that might have led to that? Yep, definitely. And I think even if there was face-to-face appointments, the public's perception was that we weren't doing those. Exactly, worrying about overburdening services that were already stretched. And a lot of what we saw in the media was intensive care. The NHS can't cope. We've got to protect our NHS. So, and I think ultimately that led to a lot of patients not coming forward and putting up with symptoms that they may now have had for a year because they didn't want to burden the NHS, or they didn't believe that they could get appointments, or even they were fearful of contracting COVID by coming into the GP surgery. So while the numbers of cancers at stage 1 or 2 fell by 60% over that time period, the proportion of those at stage 1 or 2 decreased. So there was more cancers being diagnosed at a later stage, and the overall number of cancers being diagnosed was much lower. So that was a really worrying trend in cancer care in the United Kingdom. Since then, the numbers of cancers being diagnosed has increased, but we're still slightly below the level seen before the pandemic. The NHS long-term plan has actually set out an aspirational target of having all cancer, 75% of cancers diagnosed at stage 1 or 2 by 2028. And to meet that goal, early diagnosis will have to increase considerably. And in April 2020, there was a new faster diagnosis standard that was introduced. And in March 2021, the target was set to say that all patients, 75% of patients, should have been told whether they have cancer or not within 28 days of seeing their GP. So they've set some really kind of aspirational targets to try and improve cancer care in England. Next slide, please, Amna. So just to go on to what are we doing for patients that have been diagnosed with cancer? How can we help them going forward? And this is what the National Cancer Survivorship Initiative set out to look at. And this was a partnership between NHS England and Macmillan Cancer Support. The aim of the NCSI was to ensure that those living with and beyond cancer got the care and support they needed to lead as healthy a life as possible and for as long as possible. So we're trying to increase the quality of life of patients diagnosed with cancer. Next slide, please. And the National Cancer Survivorship Initiative defined 4 priorities. The first priority was the recovery package, which we're going to talk a bit more about in a moment. But they also said that we need to redesign follow-up, we need to encourage physical activity and help patients do this. And we also need to understand the consequences of treatment. Next slide, please. So the recovery package is a series of key interventions which, when delivered together, can greatly improve outcomes for people living with and beyond cancer. And essentially, it consists of 4 key elements. There's the holistic needs assessment, which is usually done in the hospital by the cancer specialist nurses. There's then the treatment summary, which is done again in secondary care and shared with the GP and the patient. And then there's the cancer care review, which is traditionally done in primary care, which is what this whole session is about. Lastly, they like to run an educational event, which is a health and well-being event that includes physical activity and lifestyle information. So what we're going to show next is a clip which goes into a bit more detail about what the recovery package entails, both for healthcare professionals and patients. If you just bear with us while we load this, we have to go outside of this presentation, so it takes a little bit of time. Any questions at this point while we've got a little break while Amna does her magic?
There are 2.5 million people living with a cancer diagnosis in the UK today, and that number is set to grow. So we know sometime between now and 2030, that number will hit 4 million. That's a massive, massive challenge for the National Health Service and for organisations like Macmillan. And we really need to make sure that we are geared up to be able to support the patients in the way they need support when that happens.
I had 18 months of treatment. And when you get to the end of that 18 months treatment, everybody around you thinks, oh, you're better. But in actual fact, that's just the start of it, really.
The National Cancer Survivorship Initiative was a partnership between Macmillan, the Department of Health and NHS England, and it ran from 2008 to 2013. And the aim of the National Cancer Survivorship Initiative was really to look at what happens to patients when they go through treatment and live beyond what we call survivorship. And out of this was born the recovery package. The recovery package has 4 components. The first one is assessment and care planning.
Holistic needs assessment is a way of assessing a patient at various different points during their cancer journey, not just to look at the physical issues that they might be facing, but also to see what elements of emotional distress may be playing a part. So it's basically looking at the whole person, not just their cancer.
It's not always just cancer problems, it's things that affect your work or your family life or your relationships with your friends.
We're finding that it's making consultations really very focused and effective because we can very quickly drill down onto the areas that are of greatest concern to our patients.
The clinician who's carried out the assessment with the patient will come up with a care plan, which is basically a list of actions to see if we can address some of the issues that have come up in the assessment.
The second part of the recovery package is a treatment summary. And this is just making sure that there's communication between the hospital, the GP and the patient, so that everybody is aware of what has happened during treatment.
For other healthcare professionals that may not be in direct contact with that patient, it gives them the opportunity to have an understanding and an awareness from a medical perspective as to what that patient's been through.
What it does do is encourages the consultant to say, well, the treatment's finished. I would advise that you do this and this. There are risks that the disease might come back, and this is what you should do about it. And these are the signs you should look for. And also, these are the contact numbers you may need. So they get my contact number for a start. So it's a really good thing to do.
It's very easy for people to feel quite dropped at the end of their treatment. Sometimes that's the time when they come back to us as their GP to talk about things. And if we've got a treatment summary, then it means that we can have a much more useful review with the patient at that time.
The third part of the recovery package is the cancer care review. And this is a conversation between the GP and the patient. So we can make sure that the patient fully understands everything that's been going on and have discussed the needs that they might have, so that if they have needs going forward, something can be done and they can be picked up on.
How are you doing?
Fine, thank you.
Not too tired? Having a structured template for the cancer care review prompts us to think about questions that GPs don't always think about. When we first see our patients, we tend to be very medical, but in fact, for people affected by cancer, they often have very different needs and priorities that they want to talk about. Having a template that prompts us to ask about simple things about their understanding of their condition and their treatment to date, finance and benefits, checking whether they've been involved with other health professionals and referred to an OT or a physio or other people who may be helpful to them is really beneficial.
The fourth part of the recovery package is a health and wellbeing event. which locally may be known as an education event or a health and wellbeing clinic. This is a group event that happens at the end of treatment, where people can get essential information and support from clinical specialists, local providers and other subject experts. It's also where the patient can start to learn how to take control of their lives and do things around talking about exercise and healthy lifestyle issues, which will really help them going forward.
We have a marketplace of various cancer charities, providers and health information services to provide, in a very informal atmosphere, information for patients about the services they provide, about living well and living healthily, but done in an environment that is non-clinical, unthreatening, informal, and for patients to be surrounded by peer groups.
The Living Well and health and wellbeing clinics that we run give patients the opportunity to highlight problems with a clinical nurse specialist at that time, and we can also again then signpost them out from that day to other services if needs be, i.e. the dietitian clinic, the exercise clinics.
I went along to the Living with Cancer group sessions and they were amazingly helpful. Different speaker every week. Could be the practical aspects of living with cancer, perhaps some physiotherapy to help people relax, chance to meet other people in the same boat, different forms of cancer, but all wanting to get on with life. So it was immensely helpful.
Our role at Macmillan, now that the recovery package is truly developed, is to make sure that it gets rolled out as far and wide as possible throughout the United Kingdom. I said at the beginning there were 2.5 million people living with cancer. I want every one of those people to have had access to the recovery package. That is the only way that we can make sure that services going forward are truly person-centred.
Oh, brilliant. I'm glad that worked. It's always scary relying on technology, isn't it? But I thought it was a really good video in explaining the recovery package, and it gave you a break from my voice as well. Based on that and kind of what we've thought about so far, are there any issues that you think that a patient who has been diagnosed with cancer or is undergoing treatment may have? Anything that has kind of popped into your mind thinking, oh yeah, I've met that patient and they were really struggling with their weight, or they were wanting to know what they should do with their diet? Has anyone come across that, or perhaps even outside of work as well? So for me, I think that, oh, here we go. Yeah, exactly. Issues with body image, treatment and the cancer itself can have a massive impact on someone's body image. And then that obviously takes a kind of a psychological toll, and it's getting the support to deal with that is really important. And it may not be something that someone would feel that they would necessarily bother their GP about, because it's not a medical issue as such. So it's just thinking about some of the things that patients may be going through and struggling with on their own, but may not feel that they have anyone to turn to get support. Yeah, exactly. And I think getting back to work is often a big concern, and it can be very tricky. Yeah, exactly. The relationships with friends can change hugely, and I think it's being aware of all these things and knowing how to support these patients. Exactly, financial concerns are huge, and I think it's a really underestimated issue, given that a lot of people have to give up work unless they've got a very understanding employer to go through cancer treatment, because it is often so unpredictable, because you can't say, oh, I'll be off for 4 weeks and then I'll be back. So it is, there's lots of different things that affect patients with cancer. I can't see the end of that one. Hang on a second. Can you read that, Judy?
I've got other issues following arising from treatment causing problems in relationships and intimacy.
Yeah, exactly. Some surgery can cause significant changes to someone's body, and then getting back to that point in a relationship where you feel comfortable can be really difficult. And who do you talk to about that? Who is there? What support services are available? through that. And the thing is, there's the support services available to answer all of these questions, and it's just about having that confidence to be able to say to patients, oh, I know exactly who you can talk to about this, which is really useful. So next slide, please, Amna, if that's okay. Thank you for all your answers. So really, what I was trying to illustrate is not everyone is living well following their cancer treatment and their cancer diagnosis. So 1 in 4 cancer patients must deal with the consequences from their treatment lifelong. 1 in 2 patients have comorbidities that they're managing alongside their cancer as well. And 1 in 5 breast cancer patients face a recurrence of their cancer at some point. And they're aware of this when they're going through treatment. So that psychological knowledge could be quite difficult to manage unless you've got the support in place to help you deal with that. So while the side effects of treatment are often less significant than what they were 30 or 40 years ago, the number of people affected by the long-term consequences remains really significant. Next slide, please, Amna. Thank you. So why are we doing cancer care reviews? What is the kind of value behind them, and why are we suggesting that they're personalised to each individual patient? And I think that's because everyone's experience of receiving a cancer diagnosis is really unique, and people deal with that in very different ways. And being able to discuss that with a member of their practice team can be an essential part of the support that they need. And even acknowledging, oh, I don't feel like I'm managing this very well, and hearing that other people are in a similar situation can be really empowering. So by listening to their concerns and exploring issues beyond the kind of medical aspects of their diagnosis, and signposting them to the relevant local services, which there's an awful lot of, but it's often knowing where they are, really opens the door for personalised care for patients with cancer. Next slide, please. So just to do a bit of the boring researchy bit. So there is research that's been done into cancer care reviews, and what has kind of been found, because cancer care reviews have been around a long time, but there's just not been a standardized approach to them. And actually there's very traditional, very minimal guidance about how to conduct a cancer care review. And ultimately in the NHS, whether we like it or not, we're quite guideline driven. So without a guideline, there's been quite a variable and inconsistent approach to how cancer care reviews have been done. And they found, looking into this in a bit more detail, a more structured approach, which is personalised to patient needs, can actually lead to an improved quality of life and health outcomes, and then ultimately less demand on healthcare and social services. We know that someone that's been diagnosed with cancer has 1 to 3 times more attendance per year at a GP surgery for the next 15 years. So that we're clearly missing something. They have needs, and are we addressing these adequately? I'm not sure. So primary care follow-up for people with cancer, like I've mentioned, is likely going to resemble a long-term condition because people are surviving so much longer. Next slide, please. So where does the cancer care review sit currently? So cancer care review is actually part of QOF, and patients with a new diagnosis of cancer are invited for a cancer care review within 12 months of diagnosis. This was actually previously 6 months. QOF as well doesn't really say what should be included, and if you look through patient notes, often it just says cancer care review done, or rang patient, discussed cancer. There isn't really any more details to that. And this is quite often done when patients are in a whirlwind of treatment. They may be going through surgery. So some patients don't even have any recollection of this happening. Whereas actually it's a really good opportunity to do a tailored assessment for that patient. Next slide, please. So this is where the Thames Valley Cancer Care Review support scheme came into action. And in striving for excellence in cancer care, the Thames Valley Cancer Alliance developed a cancer care review template. This was hoped to bring cancer in line with other long-term conditions where templates to record all this essential information already exist. The Cancer Care Review support scheme was launched in November 2020 in Buckinghamshire, and practices were asked to sign up and to use this template for the initial first review, which can be done between 0 and 12 months. the QOF one, and then to do an additional review at 6 to 18 months, or at some point within that time frame. So this kind of allows for further patient needs to be recorded. So it's a kind of two-pronged attack to try and uncover whether there's anything that patient needs from a general practice side of things or from any other support services around. It's a much more innovative, efficient way of capturing information, and it actually provides structure to the cancer care review, which you can use as a prompt, or you can totally ignore and skip over bits if you want. But ultimately, you can tailor it to that patient in front of you. And quite often, in your kind of experience, you might know that patient quite well. So there might be specific bits that you're like, oh, I know that they probably want to talk about this, which is why we feel that you have such a pivotal role in cancer care reviews. So next slide, please. So what does the cancer care review template enable? It is just a really great way of collecting relevant information which is important to the patient. And it enables the supportive self-management and ensures an individual's holistic needs are addressed. And the patient can then actively manage their cancer care through treatment and recovery. And it maximises the support to the patient from the practice because all the information is in one place. And as much as we'd like patients to be seen by the same clinician or the same nurse, obviously patients do see different members of staff. So with regards to their cancer, all that information is captured and kept in one place. The care planning is tailored to the needs that are identified, like with other long-term conditions, and then they can be signposted to the locally available support which is relevant to them. So not given 300 leaflets and they're not quite sure which one is relevant to them. By sitting down and discussing it with them, you know that really what they need to speak to is relate, because they're having relationship problems because of body intimacy issues, because of their surgery. So you feel that actually, yes, we address their concerns, and you're supporting them in their self-management going forward. So the next video clip, which I'll let Anna get up, is just a review of cancer care reviews from the patient and healthcare professionals view. So this is patients that have had a cancer care review and how they found going through this process, and also what it's like to fill one in practice. I know that the last video, it was a GP talking about doing a cancer care review, but actually now many different healthcare professionals do cancer care reviews, and this is what we're trying to encourage because of how well suited practice nurses are to be able to do these, and other healthcare professionals. So fingers crossed this will work too.
When I came out of secondary care, it felt rather isolating, being back in the real world.
Everyone around you thinks, yeah, you know, she's not got the disease anymore, she's going to be fine, everything's going to be okay. And that's when the slump comes, because you're not going into hospital anymore, so you're not able to talk to anybody.
You really suddenly feel alone, and primary care seemed rather distant.
What hasn't happened for me is, how do you feel psychologically? People kind of take for granted, you know, oh, he's a strong lad, you know, done this, you know, it was hard. I think I had 36 treatments for radiotherapy, 3 chemotherapy, and I thought, well, actually, you know, I kind of need some help myself.
A cancer care review in primary care is essentially a conversation between an individual, their GP, and or their nurse. It's about seamless care from secondary to primary to the community.
It offers patients a personalised and holistic approach to identifying unmet needs and framing those needs as a clinician in primary care.
So looking after them in that full context of their other conditions, which may be hypertension, it might be diabetes, is definitely the way that one should be looking at it. Cancer care review has been routinely offered by primary care at 6 months post the cancer diagnosis.
Saying that, there are other times of need for that patient along their journey, and so there might be other opportunities either that come about quite naturally, for instance, alongside other reviews that they're having in primary care, where you would incorporate components of the cancer care review.
practices themselves could do a number of things, such as identifying those patients who have been newly diagnosed with cancer, sending them out letters to invite them for cancer care reviews.
I think the most important thing to remember is actually that we should be proactive. Patients have a lot on their plate. They also may not realise the amount of support they can get from primary care.
We found that supplementing that letter with some sort of questionnaire, that could be questions around how they're feeling, what issues do they want to bring up in practice, does help with the fuller discussion of the cancer care review. The purpose of the work that we've been doing in the Alliance has been to empower patients to understand the reviews. So if the practice hasn't done it, or it hasn't been done in the time that the patient has recognised that it needs to be done, then the patient is absolutely in their rights to request one too. Communication and sharing of information is so vital, particularly when patients are moving from different services or different systems.
So often if holistic needs assessments have been done within the hospital or treatment summaries have been written, getting those to the primary care team helps to make sure we incorporate all the different aspects, for instance, the consequences of some of the treatments, or even just highlighting some of the needs that have already been identified.
So I can see on tamoxifen, and that's something that I need to provide you with prescriptions for going forward. But you've also mentioned here about discussing tamoxifen a bit more and the side effects.
Maybe it's just normal. I think if you go...
As needs vary, the timing of another cancer care review might vary. It's not necessarily prescriptive after that. And there's an opportunity to do cancer care review components as part of any long-term condition review, and primary care is a perfect setting for that.
So while we just get back to the presentation, thinking about perhaps doing these yourself in primary care, are there kind of any thoughts about what things you might be asked for, or any worries of things that may come up? I think sometimes it's the worry about being asked a question that you might not know the answer to. And if I just go on to the next slide, these are some of the things that patients may ask you about, and it's just to try and think through whether you might be able to answer those, or whether you'd feel worried that you wouldn't have the right answers. So quite often the kind of benefits of physical activity, or signposting to appropriate resources like weight management services, which I imagine as part of their long-term condition management, any diabetic review, you have very good access to. There may be questions about employment and asking about how to get back into employment, or advice about this. And places like the Citizens Advice Bureau are great places that you can signpost patients to. Or there might be just general information that they want about cancer, which we provide leaflets with, and you could give those out to the patient. There may be trickier things like they could be struggling psychologically with the impact of their diagnosis, and then you can signpost them to their own GP and say, well, let's make an appointment, or we can get an appointment booked in for you to talk about that. Or they may just generally want to talk about their diagnosis and what impact it's had on their life, and not actually want any advice. It may be just a chance to chat to someone outside of the family or friend network that they can share what they've been through with. And obviously this is just a few things that may come up, but they're the kind of top things that I think may be mentioned as part of a cancer care review. Next slide, please. So just to look at what one looks like, this is an EMIS, and this does vary quite considerably, and I am going to show a short clip about how to fill one in. But basically the first page is what it says. It's the cancer care review, and you tick whether this is the first or the second review, and then you can put in there the cancer diagnosis. If you go on to the next one, please. And then you can put more information about whether there was any metastases or any lymph node involvement. But remember, all these boxes are optional. You can just skip through right to the end and fill in their well-being details, or what information they'd like. If you go on to the next slide, please, Amna. So this is more about their cancer journey, what treatment they've had. So you could even ask them, did you have chemotherapy? Did you have any radiotherapy? And usually cancer patients are more than happy to answer these questions. Next slide, please. And then it goes on to more in-depth things about their emergency contacts and next of kin, which may be already in there as self-populated in EMIS anyway. Obviously, the resuscitation side of things is for probably a smaller amount of patients, and that would probably be a a discussion with the GP, but then it goes on to health and well-being, and that gives an opportunity to talk about their health and well-being and whether there is anything further that they need from a practice point of view. Next slide, please. So I hope that this kind of shows that it's really just an opportunity to collect information as appropriate and build up a bit of a plan for that patient. There's two goes at this. They have 2 reviews anyway. So even if you just tick one box that they've had a cancer care review, then at least it's in a structured way that you can add to it at a later date. The next little clip, it's only short, I promise, is just about how to click through the screens when doing a cancer care review. It is from a London CCG, so we are going to do them specifically for Bucks and Oxford so that you have that as a reference point, but it's just to show you what is involved in that from this point of view, because otherwise I'd have to show either Oxford or Bucks, so I didn't feel that was fair. So this is just an overall view of what to do and how to go through a cancer care review.
Welcome to the London Cancer Care Review template. To start, you need to add a consultation, and using dummy patient here, we will run at the template. If it's not on your pre-selected list of templates, then just searching for London Cancer will bring the template up. The template is a comprehensive and holistic attempt to capture important details about a cancer patient. The user would not need to collect all the data in one consultation, rather they would collate information over a period of time as it becomes relevant. The front sheet here holds the main aspects such as the cancer care review and the diagnosis and medication, as well as carers. The tabs on the left then show particular aspects of the cancer care review, so cancer therapy, and most of the sections will have either drop-down menus or tick boxes and free text to elaborate further. Under therapy, you've got radio and cancer chemotherapy. We've covered quite a lot of the common symptoms for treatment consequences. Again, one would just tick the box and then free type. Psychological impact, if you wanted to screen for anxiety and depression, and tick any action that you take. Physical parameters. As you can see, we try to align this with many of the other chronic diseases. So actually, if you have coded data such as blood pressure and height recently, then that would just pull itself up automatically, so you don't necessarily need to repeat it. There's a health and well-being section which covers all the lifestyle issues. Again, if they've been entered, they would show up on the right side. Social would cover benefits and the DS 1500 form, and there is a further section on advising and signposting on how to get further help. The care plan section is the summary part where you would sit with the patient and decide what were the goals or the actions as the outcome from the consultation, and you can select each one as an action, such as action 1, and type in something like weight loss could be action 1, and then perhaps action 2 is discuss diagnosis with family, whatever you think is appropriate. And then there is a box here that really should be ticked to say that you've discussed the cancer care plan with the patient, and this is a prompt to remind you to print it off as a consultation. The last tab on the left is information, and these are hyperlinked sections for more information for the patients. So the Macmillan website, the London Cancer Directory, and some information about prescription charges. So if I just run through the top again and tick a couple of the boxes, and you can find that when you've saved it, the sections that you've ticked will then now save into the consultation. So save template and save the consultation, And as you can see, all that information is there. The last section really is to complete it by giving a copy to the patient. So you highlight the consultation, print at the top, selected items, and it will bring up the A4 sheet, and then you can print that off or email it as you wish. And that, in summary, is the cancer care review template. Thanks.
So I think you can see it looks fairly self-explanatory to fill in. There are slight variations between different areas, and I think it's and that's why we're going to do the videos, because each area may have a different template. But based on this, what is there any thoughts about what you think the benefits of a cancer care review for the person affected by cancer are? Can anyone think of any benefits to having this cancer care review in primary care? Or maybe not benefits to the patient, maybe benefits to the practice at all? Yeah, exactly. So they're in a kind of safe place, aren't they? They may have had, they know where they're going. They probably know the members of staff that are doing that with them, and they may feel comfortable in opening up to them about any concerns that they have. That's a really good point. Yeah, exactly. So it just allows for a discussion about what they're going through, and quite often, if pre-COVID, they were able to bring their family members in as well, so they felt supported as well. You just go on to the next slide, please, Anna. So it's really to give the patient more information, like we've mentioned previously. It kind of officially transfers the patient's care into the community. So they've left secondary care behind, and they're now under the remit of primary care. And it allows for time to discuss any important concerns that they have. Next slide, please. And it builds on the information collected around diagnosis, and they've had time to reflect on things as well. They may know about what the diagnosis is, the stage and their prognosis, and they have had perhaps time to discuss this with their family and carers, or just process themselves. And it just means that you can give them the information and support that they need well beyond their cancer diagnosis at a time when they might need it the most. So they might feel, like we heard in the video, quite abandoned and out on a limb, and this just gives them that reassurance that they've got support out there. Next slide, please. So some of the benefits to primary care is it really allows any healthcare professionals to check on the consequences of their treatment and for any signs or symptoms to look out for. And you can use your own personalised style to have this personalised consultation. Patients may be very familiar with how you do certain clinics or talk in a certain way, and that may be very comforting for them. Like I said, when COVID hopefully settles, then they may be able to bring a family member with them, and then that gives you an idea about the wider impact cancer has had on their people in their lives, because often it can have a greater toll on spouses or children than we fully appreciate when you just see the patient alone. And again, we adopt a very standardized and consistent approach, which can ultimately save time. So just go on to the next slide. I'll just go to the next one because we're running a tiny bit short of time. But what are some of the challenges that you might anticipate in terms of doing a cancer care review? So some of the common worries are that there's not enough information being received from secondary care. So we haven't got those health needs assessments or the treatment summaries. But to reassure you, we're improving communication with secondary care, and we're about to get these all sent via DocMan. So you will have that information there if you want to read it. Or also you can ask the patient about where they're up to in terms of that as well. There's often a worry about resources. I mean, I totally understand it. I work in general practice. It's incredibly busy. Everyone is pushed, but practices have been given funding to put these cancer care reviews in place, which hopefully will go some way towards establishing it and it becoming more sustainable in the long term. And thinking about who should do them, and that's why we set up these. So you are the people that can do a cancer care review, and you'll be brilliant at it because you're so well placed to do these reviews. And hopefully this presentation has gone some way to explaining what a cancer care review is. Next slide, please. That's just an extra one. You can go on to the next one, sorry. So in summary, the Cancer Care Review offers ongoing support in the community setting, and it provides the patient the resources to self-manage their own condition, and it just gives an opportunity to look at the bigger picture of cancer on the individual. And really, as primary care, it allows us to build our experience in this specialty, because quite traditionally it was all kept within the hospital, and it's trying to shift the mindset to now that we'll be dealing with patients with cancer a lot more, because they're living a lot longer and there's a lot more people being diagnosed. And ultimately, we want to really improve communications with secondary care as well. So set up a good dialogue between the specialist cancer nurses at the hospital. So if there's any questions that we can have, we can ring them and say, oh, I'm not sure about this, can you lend a hand? And they are so supportive and helpful, and it's more just knowing that you can do this. I think that was it anyway. So the last slide is just saying thank you, and it's got my details on. But thank you all very much for joining at what I know is a very busy time. I hope you found it useful. Any feedback is really welcome, and any ways that we can do to improve these. And we hopefully will see you on the next webinar in a couple of weeks' time. If anyone's got any questions, just shout out now or pop it in the chat box and we can go through them. I think we've got 5 minutes left, or you've got 5 minutes before the next busy session starts.
Just to say that we have successfully this time managed to record it. Hooray, it worked. Thank you, Amna, for your help too. So we will be circulating these round at some point, because I know some of you have got other colleagues that wanted to attend. So once we've got them all together, that will then go out. So if there are no questions. Okay, thank you. As Katie says, thank you all for joining, and see you. Any questions, please give either, I think you probably all got my email, or Katie a shout, and we'll do our best to help you.
Yeah, please feel free to email any questions or anything.
Okay,
thank you all. Thank you. Bye-bye.
Bye.